So task 13, we're gonna get our vaginal cytology. So what I have is my swab. I have my slide here. It's labeled with the date, the patient's name, what we're doing, and then I just have some saline. So I'm just gonna moisten the tip of my swab here. And I'm going to go into the vulvar area. Here, honey. She'll let me. And I'm gonna go kind of caudally and dorsally. Okay, I know. Oh, easy. And I'm gonna insert. Okay. Stick my hand in here. Up, and then I can flatten out. And I'm just gonna go a couple inches in and rotate a couple of times, and then pull out. And then that is our sample. And we are all set with that, so I'm going to take this back to the lab to slide it on our slide. Alright, so with our sample here, what I'm going to do is just roll it onto our slide in even layers. Kind of stagger them. I do not want to smear it, I do not want to rub it, just want to roll it in single layers across. And then I'm going to wave it in the air for a minute to dry. Doing that, I'm going to open up our stains. So this is just the diff quick set. I'm going to dip this in 1 second, 10 times into each stain, the fixative, the red stain, and the blue stain. And then I'm going to rinse. Alright, move over to our lab, and I'm just going to set this over, button down, and I'm just going to let that dry for a couple of minutes so it's sitting right there. Okay, so our side's been drying for a little while now. It's just a couple of little wet spots, so I'm trying to get those to dry a little faster. And what I'm going to do is put it on our microscope. I'm going to start on 4 just to kind of get myself oriented. So I'm just going to try to find a good spot to read from. Switch to my 10. I'm going to try to find a good spot to read from now. Right, and now we're going to change to our 100 and put a spot of oil on our slide. Yep.
What's the last name? And the dog's name? Yeah, but she kind of needs help.
Alright, and I'm just going to pause you to go somewhere a little quieter to discuss findings. Alright, so sorry about that. I just wanted to get somewhere a little bit quieter to talk about the findings on the vaginal cytology swab. We don't have a lot of dogs in our practice, patients right now, that are unspayed females. So I've actually been waiting about a month to get that spayed female dog in. She was coming in for a spay, so I wanted to use her for the swab and get that done, and everything was just getting crazy as things were prepping for surgery, so I just wanted to go somewhere a little quieter. So what I found on that slide was mostly just intermediate and parabasal cells, not really much exciting of anything. So she would be, I would classify her as in the anestrus phase. She's about an 8-month-old female, has never had a heat cycle, still doesn't seem like she'd be going into a heat cycle yet. So that's pretty much what we would expect. She hasn't been showing any signs or symptoms of going into heat. She could have, start at any moment. That could definitely change. But as of what I was seeing on the slides, like I said, mostly just intermediate and parabasal cells, no neutrophils, no superficial cells, nothing like that. So pretty clean. I did want to kind of show you a breakdown of what I find. So this is off of the Colorado State website. They've got a really great resource online for a lot of veterinary medicine, just components, a lot of different stuff. So this one goes through all of the different cytological changes in the canine estrus cycle. It breaks it down really nicely. So first off, they even have this little graph here of kind of the spikes and peaks and all the different cycles, about how long they last, receptivity, stuff like that, what hormones are going to be showing up. And then they break it down. So this kind of pretty much is what I was seeing on this slide. This is an estrus. So parabasal cells, and then the intermediate cells, superficial cells. Sometimes you might get one or two, but very small numbers are completely absent. Or you might sometimes get neutrophils, but typically not. When you're going into proestrus, you start to see a shift in the cells that are there. So you'll see more superficial cells. You'll start to see less of the intermediate and the parabasal cells. You might often see bacteria. You might see red blood cells. You might see neutrophils. All of that stuff going up. So here's an image of that. That is proestrus. So getting ready to go into estrus. And actually, yeah, you'll see large numbers. I think I said you might see red blood cells or white blood cells. You'll probably see large quantities of them. Usually this is when they start like the bleeding phase of estrus. So then we get into estrus itself, and those are the cells, the superficial cells. These are cornified. Some you will see fully cornified, so that means that they do not have their nucleus. Some will have the nucleus, and then you'll get different ones in between. So you'll get some cytologies, some dogs that go fully cornified, and some dogs that do not. So you just have to watch out for that. You might, at this point, you're still probably seeing red blood cells. You might see white blood cells. If she has been, the female dog has been bred, she might have sperm cells in the swab, the cytology as well. So just keep an eye out for that. And then after estrus, she quickly goes into, well, not quickly, but she'll go into diestrus, and the change of cells happens quickly. So you'll go from these superficial cells, either cornified or not, quickly back to the intermediate cells and the parabasal cells. So, and then you'll start to see less and less of like the red blood cells, the white blood cells as well. So diestrus can very commonly look like anestrus. They're very similar sometimes. So a lot of times you're following the cytology, so you're looking at the changes between anestrus into proestrus into estrus, and then you'll get this rapid change, and you'll know they're going into diestrus, and then it's kind of a gradual, very small change from diestrus back into anestrus. So that is what diestrus looks like. So. Alright, so we went ahead with the spay for that dog, or they're going ahead with the spay for that dog. So not a surprise that she was in anestrus phase, not showing any signs of heat or anything like that. So that's a good thing. We can go ahead with that. We don't need to mark it down in her chart because we're not monitoring for reproductivity. We were just doing it as part of this test. A lot of times with this, these swabbings, you will do it to follow reproductivity. So you want to know when the female dog is going to be the most receptive to breeding, when she's going to be the most fertile, when to introduce the male, things like that. Like I said, we don't have a lot of active breeders and highly, breeders that come in for the cytologies or things like that. So with us, we just did the swab for the female that was getting spayed, and typically that's not something you monitor for. So it's because it's harder to tell when they're coming out of the cycle and everything like that. So the change from diestrus to anestrus. So usually what we do, we don't do the swabs before spays. We just go based on what the owner is seeing, the symptoms, everything like that. And then our hospital protocol is 1 month after the bleeding phase. So kind of after proestrus is when we start to consider getting them in to be spayed. So that should be good for that. Thank you.